I think Reconciliation Week is important for all Australians to firstly recognise what has gone on in the past, particularly this year, which is 2017, which is the 50-year anniversary of the referendum back in 1967.
So Reconciliation Week is important for many reasons, but it does provide those opportunities to show in a very powerful, symbolic way that we actually care about these issues and that we value our Aboriginal and Torres Strait Islander patients, and we want to address their needs.
I can't myself imagine what it was like to go through times like that and how it must feel for someone to be not feeling welcome or a part of their own community. So for me, I think it's about respect, understanding, hearing people's stories.
Our children aren't taught enough about the history of their land. So reconciliation for me is about educating our children so that when they grow up and they come into environments like this, they can educate their children.
Reconciliation Week is a really important, visible and clear way that this country can continue to bridge the gap that we have between the people that have been here forever and us who are ostensibly travellers and visitors to this country.
I think it's important that it's not just a word, but it's around our actions and it's around our opinions and what we're doing to change what went on in the past.
Building a better understanding for ourselves about the challenges that those individuals and families have to meet.
I believe training, communication and engagement are probably the three things that we really need most.
Immersion is very important, and I think it'd be great for Aboriginal people as families coming into the hospital and as patients to see more recognition of their culture and heritage within the hospital.
Alfred Health already provides opportunities for staff for training and cultural awareness and cultural competency, but we can always improve that training, and we also need to make sure that whatever training we provide has had input from Aboriginal and Torres Strait Islander patients and communities so that it is appropriate and relevant.
The next steps which we need to take are to make our commitment to reconciliation, I think, more practical and more real.
So seeing Aboriginal people working here in valued roles would be great for them to feel more comfortable in this environment.
When I first started, we had no Aboriginal hospital liaison officers. Aboriginal patients coming into the organisation were probably hidden from everybody, and I think we've done a lot of work in terms of having some dedicated staff to work with Aboriginal and Torres Strait Islander patients.
The hospital is committed to working on a reconciliation action plan.
It's another opportunity yet again to acknowledge the inequalities in health outcomes and the fact that we really want to lessen and eventually remove those inequalities.
Education is definitely a good start. We need to learn more and understand more about the past and the experiences of others.
Reconciliation is about creating trust, it's about building relationships, about providing community with opportunities to bring to our awareness what their concerns and issues are.
Which means that we have to create an environment where Aboriginal and Indigenous employees want to come and work, feel that they want to stay here. So both the way that we attract people from an Aboriginal and Indigenous background, but also we retain them and make sure that they want to have a career here.